Dr. Vikki Petersen here. I want to tell you a story of a young patient, and the reason I want to review it is that it really goes to the point of why we treat the secondary effects associated with gluten. In other words, we don't stop at diagnosing someone with celiac or gluten sensitivity and have them remove gluten from their diet, which is an obvious and very critical first step, but the reason why we don't stop there. So this is a story of a little girl, age 6, who was suffering from chronic asthma, and she had a bad cough. She had severe episodes that occurred every month. These episodes of being on steroid inhalers would last up to 10 days each and every month. She was also on daily allergy medications. Singulair and Zyrtec were the two that she was on. These are commonly given for allergies. So when she came in to see us, this was her situation, and we found her sensitive to gluten and with indications of celiac disease as well, because she had a positive what's called a TTG test on her laboratory test, as well as her immune system reacted to gluten and casein, the protein in milk. So we got those foods out of her diet. She did very, very well over the following months, and at the end of 6 months was off all of her medications other than the Singulair, the allergy medication. She still occasionally took that for allergy symptoms. So that wasn't acceptable to us because she's only 6 years old, but even if she had been 60, when you really heal the body up, you should be able to get off all medications. So we did a stool analysis, and we found out that she had an overgrowth of yeast. So we treated that, and at the end of that treatment, she was off all her medications, had absolutely no symptoms of asthma or allergies, and did very, very well. She did very well for 7 months and then came back in. And at that time, it was just this past November, she was not only complaining of a bad cough, not severe asthma at this point, but definitely a bad cough. She was lethargic, she didn't have good energy, she was suffering from a loss of appetite, and she also had eczema, which was a new thing. And it was severe around her neck, her elbows, vaginal area. She was basically itchy all over her body and pretty miserable. Her mother, she is once again only age 6, so her mother was completely controlling her diet, and there had been no change. She had continued to remain off the gluten and the dairy. So one might say, what's happening? It's a whole new problem, right? She never had eczema before, so let's put her on some medication for eczema. No, that's not the way we think. Plus, we know this, and that is that it takes quite a while to heal that intestine after the damage that gluten has done for it. It can take up to a year. She had really only been healed up for about 7 months after removing the gluten. So, even at age 6, that's not enough time to completely heal up that intestine, and it certainly wasn't enough time for her. So our suspicion was that something was irritating that small intestine, and what we did was another stool analysis, and we found a bacteria. It's called H. pylori, and that's short for Helicobacter pylori, but this is a severe bacterial infection. Now, it was not the sort of infection, meaning it wasn't an acute infection such that she had a high fever and that sort of thing. Her symptoms were as I laid out, so she was not acutely ill, but she was certainly tired, had the eczema, she had a bad cough, and was itchy all over, so she was pretty miserable. So what this test showed was that bacteria. And as soon as we got her on the antibiotics to treat it, and within 7 days, every one of those symptoms was gone. So, what does that tell us? Once again, we have to hang in there and do the secondary effects. Look for the secondary effects associated with gluten. And that is that we know that it causes a leaky gut. It makes the ability for the small intestine to absorb good nutrients. It depletes that. It also affects the immune system because 80% of our immune system is in our small intestine, so the strength of that goes down. And sure enough, that stool test that we did showed that her good bacteria were really depleted. So we also put her on a program of probiotics to increase that. But that leaky gut can cause a wide array, huge array of symptoms associated with simply that leakiness and that irritation and the weakened immune system, which means you're more likely to get infections. So that whole scenario can take a year to 2 years, if not more, depending on the individual, their age, how strong their health status is. It can take quite a bit to get that completely healed up so you're back very strong health-wise. So simply removing gluten, while absolutely the first step and absolutely the critical step, is not enough. You have to follow up and look for these hidden infections. See how strong or weak those good bacteria are. There's a number of things associated with this, and I know we've talked about this before, but I think this case really exemplified it very well, so I wanted to share that with you. I hope you found that informative, and until next time, I wish you very good health.